stroke, it is also known as cerebrovascular accident, that is CVA. So very commonly it is known as CVA, and very less common it is known as cerebrovascular insult, that is CVI. You will less often you will use this terminology. So it is the loss of brain function due to disturbance in the blood supply to the brain, especially when it occurs quickly and is associated with the cerebrovascular disease. So it is the loss, in short, the cerebrovascular accident or the stroke is the loss of the blood supply to the brain. Thus, it stops the brain function, or it impairs the brain function. So sudden loss of neurological function caused by an interruption of the blood flow to the brain. So that's what is stroke meaning. We very well know that the blood supply to the brain, it is very well known by a terminology that is a circle of Willis. It has got different arteries supplying the different parts of the brain: anterior, posterior, lateral. So we have got the different arteries, and we have got the branches of the cerebral arteries, vertebral arteries, and going to the different parts of the brain, that is cerebrum, cerebellum, midbrain, pons, and the brain stem. So we will deal with circle of Willis in the different time, but let us continue with the stroke for today. Next slide, please. So what are the basic causes of stroke? You must be aware there must be associated some kind of the cardiovascular disease like atherosclerosis. That is the major cause of the stroke. So what happens with the atherosclerosis? It causes the thickening of the arteries, and thus the blood clots is formed, and it causes the stop of the blood supply to the brain. Plaque formation with an accumulation of lipids, fibrin, complex carbohydrates, and calcium deposits on the arterial walls that leads to progressive narrowing of blood vessels. So atherosclerosis is the most common cause of the stroke. Next, please. So how does it occur? You can see in this picture where the artery is there. Can you see the space in between? This space is reducing because of the accumulation of the lipids or any other substances in that space, and it causes the plaque formation which blocks the passage of the blood supply. Next, please. So how the blood clot is done, if you could see in the artery, this blood clot, and which turns into the atherosclerotic clot, which doesn't dissolve and which causes the blockage of the arteries. So it's very well seen in the left hand side of picture where the middle cerebral artery is blocked because of the atherosclerotic plaque. Next, please. Okay, so let us discuss in brief about the circle of Willis. So circle of Willis, we have got the vertebral arteries which comes from the internal carotid arteries from both the side. This vertebral arteries join to forms the basilar artery. This basilar artery branches out to the cerebellum and supplies the cerebellum, and then it reach the posterior part of the brain where it gives out the branches to the posterior part of the cerebrum known as posterior cerebral artery. Then it moves ahead and branches out into middle cerebral artery, which supplies the major part of the frontal lobe, temporal lobe, and the occipital, some part of the occipital, but a major part of a frontal, temporal, and parietal lobe. Anterior cerebral arteries majorly covers the frontal lobe. Two anterior cerebral arteries are communicating with each other with the help of anterior communicating arteries. Two posterior cerebral arteries are communicating with each other with the help of posterior communicating arteries. But the middle cerebral arteries do not have the communication with each other, and it is supplying the major part of the brain. So the stroke occurring in the middle cerebral artery is more hazardous and causing the large loss of neurological functions compared to anterior cerebral artery, posterior cerebral artery, and the other cerebral arteries, other arteries of the circle of Willis. We will look into each artery particular syndrome, that is the ACA syndrome, PCA syndrome, MCA syndrome, then the locked-in syndrome, lacunar syndrome, all the syndromes associated with the stroke in the coming up lectures when we are going to continue discussing about the stroke. Next slide, please. Yes. So how this collateral circulation? You must have heard about the stroke resolving within the 24 hours. So what happens if a particular artery is being blocked? A stroke is happening. For instance, if considered a stroke is happening in ACA. So that particular part, ACA is affected. But when you think about a resolving, so there are the collateral channels associated with these arteries where this circulation is, resumed, or this circulation is continued, resumed with the help of these collateral channels. And the particular function, loss of brain function, is resolved. Not completely back to normal, but up to certain extent, if you can say, it is about 70 to 80% of the function is resolved. Why? Because all the arteries in the body as well as in the brain have got the collateral channels. So this collateral channels comes into picture when a particular main branch of the artery is suffering, or main branch of the artery is impaired with the circulation. Okay, so this collateral channels is nothing but the communicating arteries in between the cerebral arteries, which are the part of circle of Willis. Next slide, please. Okay, so what happens exactly in the cell and how the plaque is formed? It is just a damage to the endothelium. Damage becomes site for the atherosclerosis. Plaque forms, obstruction occurs. All good? Yeah. Plaque forms, obstruction occurs, and it causes the damage to the particular artery and causes the obstruction to the blood supply. So this is the basic cell damage, what it is occurring. It's not different from the any other body parts. So it is the same arterial damage occurring which occurs in the other body parts. Basically, why it is more seen? Because brain is the central part of the body which controls its functions. That's why it is more affected and more neurologically involved, and it is the impairment is clearly visible. Next slide, please. Other than that atherosclerotic plaque, you might be aware about the thrombotic and the embolic. Right, so thrombotic and the embolic, it is both got the similar effect, but only problem is thrombotic is non-movable plaque and embolic is the movable plaque. It might have got dislodged from any other arteries in the body, and that emboli must have moved over and got stuck into one of the arteries in the brain. So that is the embolitic stroke. And thrombolytic stroke, that means the plaque is originated from the brain artery itself and it has grown in size, in turn causing the obstruction to the blood supply. Next slide, please. Yes, another one more type is the lacuna stroke. Lacuna stroke is because of the formation of lacuna. Lacuna is nothing but just a fluid jelly kind of space, fluid filled space. In short, I would just say just like a air bubble or a water bubble. This kind of bubbles are formed in the artery, which causes the obstruction of the blood supply. And these particular bubbles are not seen in the major arteries, they are seen in the minor arteries, just like near the brainstem, where it is branching out into different cerebellum and the cerebellum arteries going to the midbrain or pons. So such smaller minor arteries are being affected with this lacuna. Lacuna is nothing but the fluid filled spaces. In short, if you want to understand, it is nothing but the air bubble or a water bubble. Next, please. Yeah. So, how does this inflammation, or what to say, if any infection is occurring in the brain, if you must have heard about the meningitis or the other brain layer infection, right? So if the infection is occurring, how the blood supply is impaired, what happens? Because the brain have got a very good function, brain layer, the coverings of the brain have really got a good function of the blood brain barrier. So they do not allow any kind of foreign substances to enter into the brain, because the brain tissues are very vulnerable tissues. They get infected easily with the help of any foreign substance. So what happens? Because of the infection, because of the cell damage, there is this swelling occurring. There is the edema occurring that causes thinning of the covering of the layer, covering of the brain. Thus, it loses its blood-brain barrier functions. Thus, it causes the movement of the foreign particles inside, which in turn leads to aggravation of the infection. In turn, it damages the other brain cells, and thus it causes the stroke. Okay, so this is the another pathophysiology where you might see stroke occurring as a secondary thing to the infection. Any infection, it's not only the brain infection, but if any other systemic infection is there, why it is affecting brain also, and why it may lead to stroke. Okay, so what is the reason? That infection being systemic in nature, it might spread to the brain layer, brain coverings being the strongest to act as a barrier to the foreign substance, but due to infection it might lose its function, and it allows the movement of the foreign particles into the brain. Thus it causes the damage to the brain cells and causing the stroke.